MedCAD's mission is patient-matched medical devices. So we work on one patient at a time. So we don't make hundreds or thousands of anything. So every case that we design is for an individual, and we are able to take their anatomy from a CT, work with surgeons collaboratively to look at the approaches that they are going to take in the operating room and what kind of solution the individual needs, the patient needs. One of the surgeons we've worked with has told his patients, I've done your whole surgery in a computer first. We give the doctors the tools and they make the magic happen. There was a gentleman I met on Monday who had received an implant for his eye from MedCAD. He looks fantastic. You can tell that he is feeling confident about how he looks, and he told me, what his future plans are. So he has this, new sort of restart on his life and hope for his future. That was very touching.
Thank you for your support. Highly appreciate it, sir.
This is awesome, though.
Yes.
The collaboration between the Ukrainian and American surgeons, they don't work together every day. But it is almost a magic, that's a choreography that's happening, just amazing to see. Well, if I go back a little bit, I actually went to art school. So I was in a creative field after art school, which was 3D modeling and animation. And that was in the early 90s when the technology was developing to be able to model in a computer. And for me at the time, that was being able to be making sculpture in a computer. So that's how I started, and went through the 90s in 3D modeling for anything from cars to video game characters, that whole gamut, because at the time it was really penetrating, the market, and movies and television and product design and industrial design. So from there, I went on to another software company that invented sculpting in a computer. And that was a whole new leap in technological development of very realistic sculptural shapes. And at the time, I began to realize maybe this would be a tool for medical. And this would have been in the early 2000s. And I was always interested in biology or medical, anatomical type of shapes and structures, just as an artist. So when we started developing the techniques to sculpt in a computer these types of shapes, by about 2005, I started getting the attention of medical doctors, surgeons that were in the Dallas area. And there's a big hospital there called UT Southwestern. Actually, it's a medical school. And some of those surgeons in the maxillofacial side asked me, could you use your technology to do modeling of a patient's face? And that's kind of where it started. Prior to that, I was doing toys and consumer products and things like this, just in my own design company I created. So by about 2007, that is when, it started happening, to really sketch out where could this technology make an impact. And we started working with surgeons, and then there was a phone call I had one day where a surgeon asked me if I could make a cranial implant. And that was our first product. So we began to do the regulatory and the development, and by 2011 we had a first FDA cleared product for the cranium. Yeah, so MedCAD's mission is patient-matched medical devices. So we work on one patient at a time, everything we make. So we don't make hundreds or thousands of anything. So every case that we design is for an individual, and we are able to take their anatomy from a CT, work with surgeons collaboratively to look at the approaches that they are going to take in the operating room and what kind of solution the individual needs, the patient needs. And then we develop a surgical kit of sorts that has guides and models of the anatomy as well as implants. And particularly in the trauma zone and the war zone, like here in Ukraine, we're finding that the newer technologies that are available now for printing, 3D printing in titanium, allows us to be slightly more creative to work on very complex cases and produce the best solution or prosthesis for a patient. And this is really compressed as well in time. So 5 years ago, those surgeries might have had to be done 2 or 3 times. And now our mission is to develop the best solution. So one surgery, within reason, can be done to reconstruct a face. Within reason, of course, but that is what the power of surgical planning and this collaboration with these amazing surgeons, especially the surgeons that we're working with in the United States and Ukraine, across the world on Zoom calls. And then we're able to come here in country with the devices and see the impact for these injured warriors. The way I got connected with CMA and the Vision for Ukraine project, this is our third mission, although this is my first time in country, was because I have a friend that I told about in Dallas that I wanted to do something to help in Ukraine, whatever we could do as a company, as MedCAD. And she was visiting Jorge Corona for a consult. And she learned from him during the consult that he was going to Ukraine. And she said, I have to get my friend Nancy on the phone. You have to hear about what her company does, and maybe you guys could collaborate. And that's how it happened. She called me while they were in the consult, and I got to meet Jorge, and that was the beginning of our journey here in Ukraine, and that was about a year and a half ago. And I think our first mission was November timeframe of 2024. And Jorge brought the implants over, and I think we worked on maybe 5 cases then. And it's repeated up to now, so.
Yeah, Jorge is a perfect ambassador of MedCAD.
He's a perfect ambassador, and he's such a fantastic surgeon, and I have been so blessed to be amongst these surgeons in the CMA project here in the project, and then actually being in country in the OR watching these amazing surgeons work together. The collaboration between the Ukrainian and American surgeons, they don't work together every day, but it is almost a magic, that's a choreography that's happening between these professionals that's just amazing to see. So it's been sobering, just absolutely a fantastic experience to be here. And these injured heroes that are being having their humanity restored, their faces restored. It's our mission in our company as well. So we give the doctors the tools, and they make the magic happen. I can't say that I've changed my thoughts about medical care in Ukraine. I had an idea that they were fantastic surgeons, but I've seen it now in person. And they are working on extremely difficult situations and complex situations, and they're doing beautiful work, and they have a lot of volume of these patients, and we are learning from them. You know, we don't see these sort of trauma cases. So for myself as a medical device manufacturer, to see how the approaches are happening and the need, it's helping me see maybe some angles that we can iterate our design process for these types of cases. So it's a great experience in potentially improving things that we do. In the United States, we do cases like this daily. Not trauma like this, but this is our business. But because of the collaboration and understanding from the Ukrainian surgeons about the origins of these injuries and the families we're hearing about and things like this, and then we get to see the post-operative and how the patient's doing a year later, it really brings into perspective for myself and my company and my team the impact that they do every single day for every patient we work with. And we get the full story working on this project. And every day from Ukraine, I've been letting my team know what they're doing to change these individuals' lives and to impact their families and the patient themselves. So you ask about an individual patient. There was a gentleman I met on Monday who had received an implant for his eye from MedCAD, and he looks fantastic. He has a great demeanor. You can tell that he is feeling confident about how he looks, and he told me, what his future plans are. So he has this, new sort of restart on his life and hope for his future. And it gives me chills to think about. And he was just very brave man, gracious and brave man, and that was very touching. In our sphere of work for Patient Matched, I started the company in cranial and facial, and there's other areas or indications that this is very powerful. We're also now doing foot and ankle reconstruction and thoracic or chest reconstruction. So there's areas of the body that this can now be applied to, where it makes sense. And patient match, but not only just patient match, but surgical planning, because that's the other really big part of this, is how you can better approach a problem. And as one of the surgeons we've worked with has said, has told his patients, I've done your whole surgery in a computer first, so just know that I am very prepared for when I go into the OR, and I can go faster. This is what makes them be able to get in and get out much quicker and compress the amount of time it takes to do a surgery that might have taken 7 hours. They can do it now in 5, for example. Yeah. So the fact that these surgeons are working on so many trauma situations that are just not seen outside of a battlefield. So the in-OR innovation that they are, working with, but apart from that, the collective, or collaborative experience the surgeons are getting, and then passing that on to these American surgeons in ocular plastics and maxillofacial that could inform other types of cases in a non-war based situation. So it's a fertile ground to learn from one another. Just in our Ukraine cases, going online with a Zoom call with a Ukrainian surgeon in Kyiv and an American surgeon in San Francisco and my company in Dallas and maybe one of my engineers in Denver, and the sort of global
Connection.
collaboration over an hour discussion of a patient where we have instantaneous trading of information and CTs and that sort of thing, and then be able to develop and ship across the world or have someone hand deliver. So that is what our experience has been here, as if that case was going to be done in New York, So it's the technologies that we're using just for the communication and trading of digital files and things, that's obviously been around for a while. But more of that sort of ability, or potentially having printers on the other end that can just receive a file in Ukraine and print on in country. Obviously those, abilities now in a war zone, I'm not sure, but in a non-war situation, yeah, that happens every day today, So I think, we're doing it now. For the future, I'm not sure. I guess it just depends on the machines that get developed to manufacture. These machines actually manufacture pretty quickly, so we can make a cranial implant in 6 or 7 hours on a titanium printer. So the development time is getting faster, just in the machines.
And just only for
I think in a way, future is here. The
true,
future is here. Just for one patient. Yeah, when you think about that, it's sort of mind-blowing that the whole world collaborated just for one patient to receive a life-changing prosthesis,
and rebuilding their
building their confidence, and then just changing their outlook on life. When you look in the mirror and part of your face is damaged, and you can look at your face 6 months later after you've healed from a surgery, like the gentleman I mentioned. We just talked about how the future is now, and we have immediate solutions to these problems that affect a person across the world. And the disconnect is that our news outside of a war zone just tells you little bits and pieces of what's happening. And the message is that we're a global community of human beings, and this conflict, there are many people suffering, and it's not like somewhere on the moon. This is right now. This is happening right now in our world. And if you have something that you can contribute to help improve or impact the lives of other people that are suffering, do it. Because we have technologies now to be able to reach the other side of the world. We're doing it in the ways that I just described, but everyone has, it makes us realize, or it makes me realize, and hopefully my team and my company realize, that from the person that input the data, to the person that designed the case, to the person that packaged and cleaned it, to the person that shipped it, everybody has a piece of this solution and is impacting that one person and potentially that family of that one person and the future of that one person or the future of that one family. So that's what I would say, is that this conflict, or any conflicts that are happening in the world, it's the people that are suffering. And if you can do something to make an impact, whatever small thing it is, consider it. Because more than ever, we have the technology and tools to be able to reach across the world and make a change in whatever small way or large way. So that's what I would say.